WGN investigates loss of life during this pandemic. Almost every day for the past year, we've been reporting on the number of new deaths from COVID-19.
But as investigative reporter Ben Bradley finds, those numbers only tell part of the story.
The number of people who die remains relatively consistent from year to year. Increases above that baseline are referred to as excess deaths. And when we reviewed state death data, we found thousands not classified as COVID.
Known for hoops and hockey, imagine for a moment the United Center. Empty. The 23,000 fans it can hold. Gone. Well, that's the number of excess deaths in Illinois last year. They are husbands and wives, sons and daughters, fathers and mothers, and not all died directly from the COVID-19 virus.
We know that a number of people had bad outcomes, death outcomes because of COVID, but they weren't COVID related.
What's that mean? Well, last year in Illinois, 22,933 more people died than the average of the previous 3 years. 27% of them were not classified as COVID deaths.
Some of them early on are probably because we didn't acknowledge or didn't recognize that the individuals had COVID. In the middle of the worst of it and the stay-at-home orders, I think some of them, a big chunk of them may have been people not getting care. But then these that linger on much longer, the non-COVID excess mortality, are probably people who didn't get care for their chronic conditions or for their ongoing conditions during the time period where we weren't providing it.
In the spring, elective surgeries were suspended to help with hospital capacity. But elective surgeries aren't just cosmetic, and researchers are looking into whether cancers and chronic conditions left untreated contributed to the excess deaths.
And that's one of the reasons why we have to look at not just the people who die of COVID, but also the people who are affected by COVID's impact on the medical care system.
The surge in excess deaths continued in January, with 1,700 more deaths than average in Illinois that month. But February's numbers show dramatic improvement, just 390 more deaths than average. It coincided with the rollout of the vaccine to the most at-risk populations and increases in hospital capacity.
The healthcare system in Illinois anyway is keeping up. And we're able to sort of stop some of those indirect causes now, which is great news. We just want to keep it that way.
Mask wearing, social distancing, and hand washing virtually wiped out one significant cause of death every year, the flu virus. But even with the drop in flu deaths, nearly 23,000 more Illinoisans died last year than is typical. Confirmation that COVID is far more dangerous than the flu, and that it exposed significant weaknesses in America's ability to handle a healthcare crisis. Ben Bradley, WGN investigates.
Well, you can expect more mild conditions tomorrow, but a change is on the way. Tom Skilling's back with your complete forecast in less than 10 minutes.
Also, a step toward